Can you see my slides?
Yes.
Okay. So I think you gave me the task of the starting of the cholera pandemic, which is a very sad situation in Sudan, to talk in the introduction, the epidemiology and transmission. And I will try to cover that by giving an overview of the history and the background of cholera, talking about the pathogen, the pathology, transmission. As you know, the subject is very big, but we will try mainly to talk about the epidemiology, either local and international. So we start, cholera is not a new pathogen. It's known to human disease for many years and for many centuries. And actually what we are witnessing now, we are like everywhere. Like, for example, we've seen the COVID, the HIV pandemic. This pandemic is always has a trace in history. There is currently six pandemics. If you the first pandemic was between 1816 to 26, the third pandemic, the fifth pandemic, and then the sixth pandemic, which is started in seventh pandemic, which is started in the 1960, which is an ongoing till now, okay, we are in the seventh pandemic. So this is always happening in cycle. Sometimes it lasts 10 to 20 years and sometimes longer. Very integral to the history of cholera is Dr. John Snow and the discovery of the cholera transmission in London in the midst of the 19th century, which is in 1954. And for everybody sort of went through public health, they need to know about John Snow and discovery. Before 19, sorry, this should be 1850. Before 1850, what happened to John Snow, that there was a very big pandemic in London, in the UK. And people before that, they did not sort of know the way of transmission. And, people think it is airborne and people look at contact with ill people. And it was a lot of theories about that. And this is, again, very important in science. Whenever you face with a dilemma, you have to discover it through scientific means. And what John Snow did, he plotted the street of London, and every new case, he was an anesthetist, by the way, every new case of cholera, he plotted in the diagram with the streets. And then he discovered the clustering of cases happening against sort of a water bump in that street, which is the broad street. And that is very interesting because by that he put the hypothesis that it is a waterborne disease. And everybody sort of been through London and visited the museum. There is a lot of history of cholera in London, including like every country, evolving country at that time. Most of the excreta of human being was sort of went through the Thames, which used to be a dirty river and still is a dirty river. And people use directly water from the River Thames into their sort of household. And this was the cause of the transmission of the cholera. So the connection between water, contaminated water, it is very in the heart of the cholera sort of disease. We know from the microbiology that cholera is a motile gram-negative bacteria. So it's a motile, as you can see, they have flagellate, and it is facultative. It can survive in the aquatic environment as well as the human tissue. So even if it is excreted, a lot of bacteria, when they go into the outer environment, they might die, but the cholera can survive on the aquatic environment. So waterborne is a very important feature of the disease. And based on the O antigen of the liposaccharide of the cholera, it has been sort of decided into different biotypes. There is almost 200 sort of biotypes or serotypes of cholera, but only few which are toxogenic, that they produce a toxin, which is the O1 and the O139, which is causing the main pandemic. The main pandemic is caused by the O1 serotype, while the O139 caused the pandemic in 1992, which eventually faded away. And the O1 biotype has two different serotypes. People might came across the name of Altor, Jabal al-Tur, which is discovered in Egypt in the Mount Sinai uh, in the 1960s. And then because of the stereotype are divided into the Inaba and Ogawa, and as you know, this is sort of Japanese names. So to come to the pathology or the pathophysiology of the disease, is a gram-negative bacteria, waterborne. It has two main serotype, which is causes the disease, which is toxogenic. And the transmission, as I mentioned, from Jon Snow until now is the same. It's a waterborne through fecal oral route. That means it's secreted in the feces, contamination either of the hands or the intermediate. And I put here fresh vegetables, a very highly infectious sort of agent, because, for example, even if you don't clean the vegetable very thoroughly, for example, cooked meat and things will kill the bacteria. But the vegetables, for all diarrheal diseases, are a very big problem. And you have to have a household contact, even shaking hands or using the contaminated sort of material around the infected person that will transmit the disease. Another important thing for our sort of public health awareness campaign, and I've been in Sudan, I raised up in Sudan, and I know how things use. People might be careful of drinking water and water for cooking, for example, but for example, water for ablution, for wudu, for example, might not be treated in that way. So during a pandemic, this area, contact with water has to be very important for the control of the pandemic. Um, Another feature, which is sort of, I'm just checking, everybody, can you hear my voice clearly?
Yes, very well.
Yeah, okay. So another area, like any infectious diarrhea, um, it depending on what we call it inoculation dose, because two people might get exposed to the same pathogen, but one get infected and the other is not. And that depending on we call it inoculation dose, that means you have a very high bacterial burden because the pH in the stomach kills the bacteria, okay? And then you have to have a more than 10 to the power, that we're talking about almost 100 million pathogen on the inoculum to cause it, So the bacteria has to pass through the stomach, the pH of the stomach, then to go to the small intestine to cause the disease. So people, for example, taking antacid, patient, anybody who had low decreased pH for any medical condition will have higher risk, including immunocompromised patients. And people might remember the sort of United Nations and the UNICEF and the um, big survive about sustainable development goals, which is launched in 1915. And the sixth pillar of the sustainable, which is almost 30 goals, that they said about provision of clean water and sanitation. And this is a basic human need. And despite that, people can talk the two big affected continents are in Asia and Africa. Is still problem with clean water, list of sanitation remain a big problem. And I can show you figures. These two problems are the main reason for people sort of infected with cholera. So access to clean water and sanitation. And this is, just to show you, we are living in an inequality world, and we are, living in a very bad situation and time of our human sort of history. This is the World Health statistic from 2023. Only 54% of the global population are using safely managed sanitation services. Only half of the world population having, safe access to sanitation. About 3 in 10 people worldwide did not have basic hand washing facility with water and soap at home. Okay, just to show you, when you talk about this pandemic, and I'm sure a lot of you people might talk in the civilized area in Sudan, but what about the remote area where the disease can be rife? And since 2023, the WHO, actually, this is not only in Sudan, but across the world, the WHO declared the global cholera resurgence as a pandemic. And they put it as you know, they put grading for that. They put grade 3, emergency, necessitating major to maximum responses. So this cholera is not only in Sudan, but across the world, and I will show the country, is a very big problem. And the WHO actually is stretched, and even stretched more actually with the current situation, as you know, in the American sort of affecting the funding of the WHO. So this is the problem exists and continue to exist. And you know, in 2023, 500,000 cases were reported. And the highest country are Afghan, Haiti, the Democratic Republic of Congo, resulted in almost 4,000 deaths. And there was 71 increase in deaths from the previous year. Okay, and if you look at this country, and I think it is akin to our situation in Sudan, what will connect Afghanistan, Haiti, and the Democratic Republic of Congo, you can see is all war and displacement. And the WHO saying the failure to implement effective water sanitation and hygiene are the core of this problem of the cholera pandemic. So this is everybody. If you want to talk from a public health measure, you want to control it, it has to be this effective water and sanitation at the heart of this. The pathophysiology, I know some others might cover this. I try to do very, very brief. We said orophycal route goes through the gastric acid in the stomach with high inoculum, and then it comes to the small intestine. And what is interesting about the cholera, the cholera is not cytopathic. So it will not cause like E. coli, for example, Salmonella and Shigella. This is, we call it enteropathological, by causing invasion of the mucosal tissue and then causing diarrhea through that. The diarrhea it is very interesting. It is toxin mediated, and this toxin works through the cyclic AMP, and as you can see, and it will disrupt the fluid transport within the small intestine. So it blocks reabsorption of sodium and increase excretion of chlorine. And what will happen, it is very simple. It is osmotic diuresis, osmotic diarrhea. So because of the non-absorption of sodium and the high content of the chlorine on the diarrheal fluid, you lose bicarbonate, which will cause acidosis. You lose a lot of fluid, and it's been estimated actually within 5 days, human being can lose the entire weight in 5 days. So if somebody is 60, 70 kilogram, they can lose 560 kilogram of water within the illness. So, because if you want to control any condition, as you know, in medicine, you just have to reverse it. So people have to know the pathophysiology of the disease, mainly stemming from water loss, leading to shock. And if you look at the extreme of age, the young and the elderly, for example, if they lose 10% of their body weight, that is substantial as compared to somebody who's 60 or 70 kilogram an adult. So young and old, the extreme of age, are the high mortality. So this is, even if you want to do sort of risk stratification of how to manage your patient, you have to manage the young and the old more than the adult, because the adult can withstand the dehydration more. The role of antibiotic, can be covered elsewhere, but the role of antibiotic is limited actually in cholera because it's all about fluids replacement. And if the individual, the course of illness is very short, we're talking about days, sometimes less than a week. So if the people, and the worst days is the first 48 hours. So if people can manage to pass through the first few days of illness, eventually they will recover, provided, and it is very important to have, supportive measures. And these supportive measures, we mean by that, it is fluid replacement. So cholera is a severe diarrheal disease that can be fatal within hours if not treated. Again, this is very important. People need to act fast. When you manage this patient, it's not about leaving to assess the patient tomorrow. So you have to do your assessment today, because that patient might die within the next few hours. And as I mentioned, within days, they will lose bulk of their waters. And if you look at the symptoms, because this is high bacterial burden, cyclic AMP work in the small intestine very quickly. So the symptom appear very quickly, and it doesn't need as the bacteria to grow because it is toxin mediated. It can work, immediately. 12 hours to 5 days after infection, and quick access to treatment is crucial, as I already emphasized that. And most people with cholera have no, only mild to moderate symptoms, which can be treated with the oral rehydration solution. And as you know, the oral rehydration solution, which is created by the WHO decades ago, is very simple. It's just sugar and salt to replace this sodium loss and the glucose, which will oppose the osmotic diuresis from the cholera. And severe cases, unfortunately, because the fluid loss is very high, people can talk about the protocol of the fluid replacement in cholera later on, but it has to be IV. So if somebody clinically dehydrated, severe dehydration, giving them oral rehydration solution might not be enough. So you have to give them IV fluid. And have been following the pandemic actually in Jazeera State before it reached Kosti. And I know actually most of the people I ask, the people die on transit before getting to the hospital or before they getting resuscitated. So if people get resuscitated with fluid replacement, they will survive. There is an oral cholera vaccine, and I will show a picture later on about that. This is people can talk about this, but the oral, as you know, this is a preventative measure. Not a lot of people, I will say the majority of people in Sudan, then haven't used this oral cholera vaccine, but you can use it eventually after the development of the pandemic in a situation, as you call it, ring fencing. Um, People have to be aware that most people infected with cholera do not develop symptoms, but can spread the bacteria to their feces for 1 to 10 days. And that is very important. Some people even have a mild diarrhea. They don't notice that while they have cholera. And this is a burden of the disease. So education about hygiene and sanitation and things not only affect the affected individual, but anybody in their community. Whenever this is an important message for people in public health. You have to, when you have a pandemic, you have not only to affect the symptomatic patient, but asymptomatic as well. And as I already mentioned, mortality mainly in the severe disease. So I've done teaching about dengue before. Most of fatalities in dengue with severe disease. So you have to do on your protocols how to diagnose severe cholera very quickly because these people who will die. And I already mentioned the extreme of age, the young and the old, and this has to be looked after. So with colleagues, since the war erupted in April 2023, and we've seen significant sort of shift towards disaster and infectious disease. This has been said in many sort of previous. This is not new, by the way. Infectious disease and war, any war, when it erupts, it will be in tandem with it will come infectious diseases for many reasons. It will include viral infection, bacterial infection, and then we see diarrheal disease. And this is for many reasons, which so together with colleague, many of you might know in the US, some of our colleague like Izzuddin who started and Khalid Dosa who started this idea, as well as our colleagues sort of Nada Fadul, Yasir Hamad, Zahir, and Ahmed Babikir who coordinated this. We wrote this to the Lancet actually October 2024, but this has been written since 2023. And we mentioned the importance of further two-thirds of the 80 states affected by 3 or more infectious disease outbreak. And we knew that because the cholera started actually in 23, cholera, dengue, and malaria and measles, and this all goes with war. And we ask in this publication, the international organization to intervene early because we knew this is going to be a big problem. So in 2023, because as I said, this is not, as you can see, at that time, Sudan was free of cholera. You can see the burden in the south of the Sudan. And the bigger this blombogram or the bigger the circle, the bigger the case fatalities. As you can see, DRC, for example, Malawi, Mozambique, Afghanistan, and even sort of Myanmar and Bangladesh were sort of affected area. And as I mentioned, the burden of the cholera worldwide, it is in Asia and Africa. You can see Haiti, and because of the war situation, it's the only outlier in Central America. So this is 2023. At that time, we have no problem in Sudan. And again, this is sort of in 2022, again, Sudan has few cases, but only almost negligible case fatality rate. So no deaths at that time. The darker the color, which will show where the country are affected. And as I mentioned, you can see cholera can happen even in North America, but usually on in a good health situation, patient will not die. But if you have a poor and outstretched health system, death ensues the outbreak. So the current situation from the WHO from January 25 to February 25, 45,000 cholera cases, including almost 500 deaths. This is global deaths. People will call it case fatality. You can look at the deaths and then look at the number, and you can clearly see this is very similar to the dengue, that there is a lot of cases, but there is relatively few deaths from the cholera, despite the gravity of the disease. The deaths remain below 5%, sometimes below 3 or 2%. But if you look at this patient, some of them might be 300-400 might be young kids below the age of 5, which is devastating. Um, um, so the evolving pandemic's been going on for a number of years now, and unfortunately, because of the war situation, it reaches in Sudan. The countries affected: Afghanistan, Angola, Bangladesh, Burundi, Democratic Republic of Congo. But if you look at the recent problem, South Sudan, again, the problem is bigger than the north of Sudan. Afghanistan, Yemen, Democratic Republic of Congo, Angola. But if you look at the bottom things, the 5 countries reported most new deaths are South Sudan, Angola, Democratic Republic of Congo, Sudan, and Nigeria. So this is the new countries, which is in the beginning of the year, we're seeing increase, reporting as well as deaths. And as you look at the link between all these countries is mainly because of displacement and instability of this country politically. And the association of war with cholera is not new. You can dig the picture even in any very big wars, because before 1850, before we know the reason of transmission, soldiers moving into big things, displacement, access to water, bring cholera with it. So the association, and we've seen that, for example, in Yemen and Syria, and we've seen it in Democratic Republic of Congo, and now in Sudan, unfortunately, because of the war, these sort of infectious disease follow wars inevitably. So I came across this paper, actually, mentioned in the Lancet. I think some of you might be aware of these colleagues, Yusuf Ali, Emmanuel Sadiq, Ayman Ahmed, in the Lancet in November. So also they were, going through the same line of the infectious disease group, and they talked about the first resurgence of the cholera, and this is what's happening in November 20. And look at that. This is July. This is 3-4 months after the war erupted, and they looked at the attack rate at that time was 4.4%, associated with 316 deaths with a case fatality of 2.8. As I mentioned, because they said children younger than 5 years account for 16% of the total cases. And this is, they said, primarily driven by 2 factors: the effect of war on the health system and the climate change. If people remember, there was very bad flooding in late 2023, which has added or rubbed salt to the wounds. And that is because of the water expansion. For example, people will have not access to more safe water during bad sanitation situation. They mentioned that the mortality rate was exceeding the sort of WHO criteria. But I will add to this, actually, to their observation is a disruption of the health system. This is a major issue. For example, IV fluid might be deficient in a number of healthcare situations. Even hospital might not be able to manage this patient. So the disruption of the health system in Sudan, I think, is one of the major factors which causes the current pandemics. The UNICEF, this is again mentioned, this coordination of humanitarian affairs indicate that more than 10 million Sudanese people have been internally displaced. And this is, we're talking about at least 1/4 of the country population. And then the more than half of the population facing hunger, including almost 800,000 people at risk of famine. Okay, and then the ongoing conflict has severely impacted the infrastructure, including health facilities, the operation and stability of water services, leading to a decline in the resilience of the health system. And this is again one of the big problems, as we know. So resilience of the health system, the ability of the health system to cope. And I'm sure in a number of affected areas, you might find the influx of patient is more than the capacity of the health system. And by that means, unfortunately, even the triage, which I'm suggesting might fail if you have, for example, 20,000 admission in a small hospital. So again, another colleagues, I came across Hassan Al-Bushra, Ahmad Harun, supervised by Dr. Hassan. They've done their experience in Gadaref state and they published this. They looked at the 2023 cholera outbreak in Sudan. I'm showing this because in science, you don't need to reinvent the wheel. You just need to look at what other people did, and it will be very sort of matching of what is happening to you. They look at the retrospective study of confirmed cases of more than 2 years, and from 138 health centers in Gadaref state. They looked almost 2,000 cholera cases. Most patients have severe watery diarrhea. And I emphasize this, as you can see, the severe watery diarrhea is the mainstay of the pathology of cholera. So almost 100% of patients have severe watery diarrhea. And vomiting, it happens in about 70%, followed by dehydration. So diarrhea, vomiting, dehydration. This is the three mainstay of the cholera diagnosis. The attack rate was 6.7. This is number of affected, number of people, if you calculate them by exposure. There was 46 deaths, giving case fatality ratio of 2.6. And most likely the paper which went to the Lancet actually was taking from this. And then their conclusion is very similar to what I was echoed. Prolonged period of outbreak, the high case fatality rate highlights the need for better laboratory and epidemiological surveillance, as well as better preparedness and response to future outbreak, along with educational activity to address misses and misconception. In a previous, ECHO program, some of our colleagues said people, think the cholera is like the COVID, so they concentrate of wearing masks. So this is the misses and the misconception, which need to be demystified. And to do this, people have to know that it is the oral fecal route and hand sanitation is very important. And as you know, you got famine and you also got ignorance, one of the very big enemy to human health. I got this actually, this is only been published yesterday. The UNICEF already mentioned about the coast state, 300,000, in Kosti. And this is published by, I think, Eva Hines. And when I Google her, she's a communication officer from the UNICEF based in Port Sudan. More than 500 children and from 3,000 cholera cases that have been reported in the coast state. And if you look talking about 300,000, I can see why it is almost very difficult to contain an epidemic like this. At least 65 people died, including 10 children. And the UNICEF and the Federal Ministry of Health and humanitarian partners, they are scaling up. So the scaling up is very important during the pandemic. So you need even the oral hydration, even the IV fluid, even the oral vaccine, as I can see on this UNICEF ring fencing affected individual, giving them the oral polio or the oral cholera vaccine. And although it's not 100% effective, even if it have effectivity of 80%, that will be very good in this situation. So like any pandemic, there is an epidemic curve for it. Okay, this is from the Gaddafi state. As you can see, the pandemic started around August, September, and then comes October, November, because probably the flooding and the water, it reaches its climax and then eventually dies away. So in any pandemic, this has happened to anything. Even in Costi, eventually you will pass through this. But what will be the crucial is to try to contain it by training of your, as much as sometime you need to scale up participant, rapid diagnostic. The diagnosis in the resource limited area has to be clinical. And this is, I'm sure your public health already talked to you. Patient coming, for example, diarrhea, as I showed to, patient with diarrhea, more than X episode per day, that is, cholera till proof otherwise in an infected individual. There is rapid diagnostic test, but I don't think it will be important as the clinical evaluation. So you have to reporting, because unless you do the surveillance and report these cases, you cannot contain them. And then you come to the last resort, which is the timely treatment and prophylactic therapy. Very important in any pandemic, we've seen it in the COVID, what we call it flattening of the pandemic case. And for public health, because if you have like 300,000 infected individual and each one of them infected 2 or 3, then you will talking about thousands and thousands. So the mainstay of any pandemic is to try to control it as soon as possible and flattening the curve, because by decreasing the number of infected individual, you will control the pandemic curve. And this is multi sort of intervention. You can do that through public health awareness, personal responsibility, and management of cases. But public awareness plays a very important role during a pandemic, because if you manage to control the disease over a few weeks, then you will interrupt this the pandemic curve. So in summary, I hope I just gave you, this is an overall sketch. This is not a detailed lecture or about cholera is a gram-negative motile bacteria, which is highly infectious. The pathogen survive in the moist environment, and the main route of transmission is orophycal route, and that is very important. You have to demystify any myth against that. So it's contaminated food and drinks, and well as contact with infected individual, including any source of water, any source I emphasize. War, displacement, and environmental disaster are the main reason behind pandemics, not only for cholera, for others. And there is an evolving pandemic in Sudan erupted because of the war situation, which is difficult to contain because of the collapse of the health system. And I know from a number of colleagues, difficulties actually even providing the basic needs for this health system. And the disease causes intractable diarrhea with substantial fluid loss. This is the main pathophysiology. So to reverse that, fluid replacement remain the mainstay of management. I think that my last slide. I'm more happy to go for the next part. Yeah.
Thank you so much, Dr. Hamad. That was really insightful, considering the situation now in Sudan and right now state. Maybe we can open the floor for some questions. Uh, uh, if
But if I want to invite Matasim, he's an
yes.
epidemiologist. Matasim, if you have any insights you want to add, please go ahead.
Hello once again. Thank you, Dr. Abdel Hadi. Yeah, was really informative session, and I think like you covered most of it. I don't have really something mainly to mention, but just to emphasize on like in terms of situation in Sudan, like an increase in the number of cases, especially like the one that happened in the White recently in the White Nile, and before this, even the number of cases started to decrease. Then again, due to the movement or the displacement of people from Al Jazeera, to area of Al-Fao and Al-Gadarif area, then again this like increase the number of cases, like despite the effort that is undergoing to like to stop the spread of the disease. So if mainly like for example for the vaccination, which is one of the important pillars in controlling the disease, and I think now MOH and WHO started to do vaccination also in White Nile. But again, one of the things that I was thinking about, like now currently they are giving like one dose of vaccination, and if you provide like 2 doses, this will most probably protect for uh, for 3 years. So one of the things that I think about it, like why not like to advocate for more providing more doses, like rather than just providing one dose. And then one of the things also, the community is is one of the important pillars of the control of the disease. So one of the recommendation from my side also, we need to work all together, like the medical staff currently working and attending this session. As Dr. Abdel Hadi mentioned, like for example, for the ORS is something simple, and sugar and salt is available in each and every home. So it will be good also to raise awareness about this kind of things, because also as Dr. Abdel Hadi mentioned, in most of the situation, even in our situation, like in the field, most of time, like we receive cases coming as plan C, which they come really at late stage. So if we raise awareness about importance of like simply preparing the ORS at home, even if even if it's not yet cholera, then this diarrhea, if we we prepare this ORS at home, might save more people. So yeah, this is one of the things also. And for me also, one of the important things is the early detection, which it can be through surveillance. So this is also one of the important things, like to emphasize more on early detection and surveillance system, because also as we know that like the ongoing war affected the health system as general, and therefore there is an erupted surveillance system. So I'm also again focusing on community, like to work together with community, because we cannot cover it all, like even the health personnel and health authority and MOH, they cannot cover this all because it's big. We see that the number of cases is very big, and the need is very big. So one of the good things is like to raise awareness among the community and to collaborate with them for early case detection and identification. And then in terms of prevention, I know that there will be more sessions about IBC, but also this is one of the things I wanted to mention. I have seen one of the questions in chat, like asking about the Vibrio cholerae originated and created from is coming from that animal and that person. Yeah, for me, and Dr. Abdul Hadi maybe can add, but for me, I think because bacteria most probably like normally live in water, so the main source of it is the water source, and then from there that people they get infected and transmitted among each other. Yeah. For the field, for us in field as MSF, working as MSF, normally one of the important things like for the outbreaks like cholera, uh, we focus on surveillance and like outbreak investigation, and then we reflect as reporting in which most the important things is like time, reflect on time, person, and place, like to reflect on number of like the magnitude of the infection over time, which is most probably through the EB curve, the epidemiological curve, to show the magnitude of the infection over time. And then this can help in controlling the disease and understand the infection, magnitude of infection over time. One of the important things also, the geographical distribution, which is place. This is also one of the important things that I want to emphasize on. It's like uh, to show the cases through map. This is really will help like as visualization to understand the distribution of the cases and transmission of infection from one place to another. So like this, we can it can help us to control the disease more easily. And then also, of course, the persons, because some like age groups are more vulnerable to disease. So also to reflect on the affected personnel and like the case fatality rate and the attack rate. Also, these are important indicators in outbreaks like cholera. So yeah, these are main things that I want to mention. And yeah, this is all from myself. Thank you.
Thank you so much, Dr. Mu'tasim, for your input and sharing your experience. So yeah, I don't think I don't see any more questions in the chat.
I guess add to some input about why cholera during this time. So people have to think when they were in a stable condition before the war, everything was stable. You can have access to sanitation, you can have access to water which is chlorinated for daily, for drinking, for preparing food and everything. When you get the war, this is all get disrupted. For example, you got displaced people, their access to water, you can look at any camps where they get the water from. And that is very important thing. A lot of people will get the water, for example, directly from the Nile, for example, okay, or from a well, which is completely different to the previous control situation for drinking, for cooking, and for example, for daily activities. So because the bacteria lives on the plankton of the water, so it is very high burden. So one of the areas which people need to understand, for example, to boil water, and that is an important area. So even if they get well water or they have the water from the Nile, one of the intervention which is public health specialists should emphasize of boiling the water during the pandemic, because this is where you will get the infection from. So even you can boil water, you can use it for everything, then it will be safe. But if the water you use it directly, that is a very high risk, and then you have the, people again during the pandemic to try to avoid eating raw vegetables. Even sometimes if you wash them, a lot of people will wash them with contaminated water. Okay. So you might just try to bridge weeks or a month during a pandemic of try to avoid hand hygiene, water, as well as fresh vegetables. And this is where the infection will pass through. And the increased number of cases, unfortunately, will means increased propagation of the pandemic.
Sorry, once
Absolutely
again.
true. Yes.
Yeah.
Yes.
Yeah. Sorry, once again, like just also to add, just Dr. Abdel Hadi, you remind me, like when we have been working in the field, like we used to ask like the patients and the caretakers about the source of water, and in one of our projects, like around at one point around 79% of them, they saying like they are drinking from river or canal. And this is also, as you mentioned, this exactly confirm what you mentioned, that people normally they drink from this source of water, and especially during the rainy season, because last year also, uh, after and during the rainy season, the number of cases was really high, and then this year also. And then if there is nothing sustainable, then I'm wondering that this will happen again and again. And yeah, also those people coming, like they are drinking from this source of water, and also because of maybe the awareness, and because sometimes uh, in one place there was like clean source of water, but it was not enough for all people, and then people they don't want to wait until get this water, because there is a lot of people in front of them. Then again they go and take from the canal and river. And then also one of the things, one of the hygiene, like because as you mentioned, Dr. Abdel Hadi, the transmission is through fecal-oral route, and the open defecation also is one of the big issue and big problems. Uh, some of it because some people they don't even have latrines in some places, and some people they have believed that they don't, it's like they don't like the latrine, they don't like to go to latrine, so they prefer to defecate openly, which also again it like increase the problem, because they are living through and around the river and canal, like in Gadarif area, like there is a canal going through many villages, and then people they are living around this area, and they openly defecate, and and they drink from the same source of water. It's not their fault, and it's not bad that some people they having their own cultural belief, but also we need to work all together to raise the awareness, and yeah, also in terms of resources, because of the ongoing war and because of the situation of the country, it's difficult to cover it all. But I mean, yeah, it's really important to work all together and to include the community in our intervention and in our planning and preparedness. Thank you.